everyone, my name is Na with Parkwood Home Care, and I'll be going through some personal hygiene tips for family and friends that need assistance with this. So what is personal hygiene? Personal hygiene is care for the body that promotes comfort, safety, and health. So personal hygiene may include oral care, skin care, and intimate hygiene or hygiene for the genitals. So illness and disability can change people's ability to help themselves with any kind of personal care. So some key words to note is AM care, which is also early morning care. We also have afternoon care, and we have HS care or PM care, which is the same as evening care. So people in the health industry use these abbreviations when they are providing care, depending on the day and the time that care is being provided. So we're focusing today on oral hygiene, and with oral hygiene, it's practices that are done to keep the mouth and teeth clean. It includes brushing, flossing, denture care, etc. So some family and friends or some clients may have their regular teeth in, or they may have dentures. So providing denture care is also an option with oral care because it could be one or the other. So importance of oral hygiene. So apart from oral hygiene, keeping the mouth and teeth clean, which is quite obvious, it also prevents mouth odors. It prevents infections in the cavities. It increases comfort because when you have good oral hygiene, you feel more comfortable when you're eating, talking, and stuff like that. And it also makes food taste better. So that's important as well. So effects of poor oral hygiene. So there's biofilm. Biofilm is it's a film that covers the teeth. Like when you wake up in the morning and you haven't brushed your teeth, there's a film that covers your teeth that is biofilm. So as biofilm builds up, it turns into tartar, which hardens up on the teeth, which is very bad for the teeth. It also leads to periodontal disease, which increases the risk of heart diseases, bad breath, bleeding gums, and you also have bacteria that goes into the mouth, which is aspirated, can cause pneumonia. So some equipment that you need for oral hygiene: a toothbrush, toothpaste, denture floss, or mouthwash. So some equipment for denture cleaning is there's denture cleaners, denture cup, or denture toothbrush. Some people use regular toothbrushes, but there are some toothbrushes that are specifically for dentures. And when you're cleaning dentures, it's important to make sure that you have like a piece of towel or like a face cloth in the sink, because dentures are usually very expensive, and if you're cleaning it and it drops in the hard sink, it might break. So just a little tip to make sure that you have like a cloth in the sink when you're cleaning dentures. So these are some pictures of stuff people need for oral hygiene: toothpaste, floss, denture cleaner. There's some mouthwash there. This is a cup with dentures in it. People have different kinds of cups they use. Some people just use regular glasses, and a toothbrush. And with the toothbrush, it shouldn't be too hard on the teeth, because then it will make your gums bleed again. So some observations that family or main caregivers or primary caregivers should be watching out for when they have a client with oral hygiene wise is to make sure, be checking if they have dry, cracked, swollen, or blistered lips. Check if they have bleeding or swelling gums, sores or white patches on their mouth, missing or loose tooth, rough, sharp, or chipped dentures. Please make sure that people's dentures are comfortable and they're not chipped, because that will cause more harm to their gums. Very foul breath, difficulty swallowing. So difficulty swallowing might be an indication of bad oral hygiene, and pain and discomfort. So some recommendations when you're brushing your teeth. There's no specific way of brushing your teeth. Some people say brush your teeth in a circular motion. Some people say up and down. Some people say side to side. But as long as you're making sure that they are having oral hygiene daily, that is the best approach. Thank you.